So the injury that I have selected is Achilles tendonitis, and I'm going to be palpating on myself. 3 bony landmarks that get affected by this injury are the calcaneus, this X right over here, the tibia, and the fibula. Alright, and 3 soft tissue structures that get affected by this injury is obviously the Achilles tendon, which inserts at the calcaneus and goes up to the gastroc. It's this line right over here. The gastroc, which is this line, the big bulging calf muscle that also gets affected, and the peroneus brevis tendon is a lateral tendon near the calcaneus. That one right over there. All right. I would say long-term treatment for Achilles tendonitis would be physical therapy, would be the most effective, strengthening the tendon and calf muscles along with it, and heel lifts to shorten the Achilles. And to demonstrate heel lifts, I do not have any right now, but it would be something like this. Not quite, but in your shoe to shorten that tendon and relieve that pressure or pain. Acute treatment for this injury would be anti-inflammatory medication such as ibuprofen, because the pain and the injury, the mechanism of injury is inflammation in the tendon, and anti-inflammatory medication will reduce that pain, and also rest or price. So it would be rest, ice pack, and you would elevate and put ice, or you can tape ice around to hold it there, also relieve that inflammatory pressure. All right, and now, so those were the main points for the injury selected. So since I did foot and ankle, I am going to do 3 bony landmarks of the hip and the knee. So the 3 bony landmarks for the knee I have selected is the patella, tibial tuberosity, and Gerdy's tubercle on the lateral side of my knee. As for the hip bony landmarks, I've selected the iliac crest, which if you dig into your hip would be this top part of the crest. That is the iliac crest right over here. Up here, where your fingers sit on your hip. And then when you go a little down, this first edgy point in your hip would be the ASIS. Or you can look at it like this. Oh God. pelvis. So this would be the ASIS, and this would be the iliac crest. Iliac crest. And go further down, and it's edgy points, and that's the ASIS. So those are two. And the last one would be the greater trochanter of the femur, and it's this, if you kind of stick your hip out, you could feel it. There's like this dip, and then this bony part right under your pelvis, and that would be the greater trochanter of the femur. And that is the end of my video.